So next I'd like to introduce Zhong, who is our dietitian. We have a large focus in our epilepsy program on the role of diet in treating epilepsy. And as we have found, and you probably saw from that graph, we know it can be effective in sunflower. And Wing will talk to you about overall dietary therapy in epilepsy and probably hopefully give a shout out for our ongoing trial in sunflower syndrome. Wing.
Hi everyone, good morning. My name is Wing. In addition to the tech person in the room, I'm also the dietitian. So I have been in the pediatric epilepsy program for 2 years, and today is my pleasure to talk to you, to introduce about the ketogenic dietary therapy for epilepsy. So I'm just going to briefly talk about 4 dimensions on the diet. So one is how effective it is for seizure control, and 3 main different types of the dietary therapy, as well as our process of starting the dietary therapy here at our program, and also additional resources. So before talking about the efficacy, it's interesting to know that the history of the dietary therapy. So actually, 1,000 years ago, like more than 1,000 years ago, probably Hippocrates actually documented a case where fasting seems to be helping seizure controls for individuals. But as we all know, that humans cannot survive without food. We all need food to survive, so it's definitely not sustainable to fast forever. So like in 100 years ago, actually, the classic ketogenic diet was officially developed to mimic the fasting stage to help to treat seizures. So in a paper in 2006, it's found out that about 1/3 of the individual, like kids on the ketogenic diet, seem to have more than 50% reduction in the seizure frequency, and also about 1/6 of the patients, of the kids actually achieve seizure freedom on the diet. And in a more recent 2018 consensus paper written by all experts in the field, including Dr. Thiel is also on the paper, experts have found that there are different conditions that seem to benefit more from the dietary therapy. So including epilepsy symptoms like the Angelman syndrome, Dravet syndrome, Deuce syndrome, tuberous sclerosis complex, and also other metabolic conditions where people have difficulty in metabolizing carbohydrate. They seem to benefit a lot from the dietary therapy. But currently, we do not have studies, as we know, that to study the sunflower syndrome. So that's why Dr. Thiel actually mentioned we have an ongoing study trying to look at the low glycemic index treatment, which is one of the ketogenic dietary therapy, to see whether it is helpful to treat the hand waving or the seizures in sunflower syndrome. So next I'm going to talk about 3 main types of the ketogenic dietary therapy. So the first one is the classic ketogenic diet. So that's the one that you have to measure out everything on the gram scale, and the majority of the calorie from the diet comes from fat, such as oil, heavy cream, and then a lot of other high-fat items. So it also can only allow very small amount of carbohydrate intake, which is about 10 grams a day. So just to give you a context, on average, an average American eats about 200 grams of carbohydrate, if not more, per day. And a slice of white bread is 15 grams of carbohydrate. So that is very limited for a lot of our kids. So they have to be supervised very carefully under medical supervision. And also it takes incredible effort from the family to implement the dietary therapy. But also we keep track of our patients on the classic ketogenic diet very closely to make sure they receive all the nutrient they need to not develop any nutrition deficiencies. And then there are also 2 more liberalized type of ketogenic diet. One is called the modified Atkins diet. They are not usually done at our center, but other dietary therapy center does use that for adults a lot of times, because they actually allow for more protein intake. So you can eat more meats, more fish, more eggs, and things like that on this diet. But it still is only allows for a very small amount of carbohydrate intake as 10 to 20 grams per day. And then at our center, we use the low glycemic index treatment the most often because we think it's the most flexible, and also it allows for more it reduces the potential side effect while for our kids on the diet. So it's actually allows for 40 to 60 grams of carbohydrates per day, but it should come from like the ones that doesn't spike your blood glucose so as high. For example, if you're eating candies or desserts, your blood glucose will shoot up immediately and then comes down. But if you're eating a whole grains or like whole grain bread, or if you're eating something like the green leafy vegetables like kale and things like that, it doesn't spike your blood glucose as much. And that's what we hypothesize why this diet is working to reduce seizures. And also the good thing for this diet is that you can actually not using the gram scale, you can use household measurement like measuring cups, measuring tablespoons and teaspoons. And some of the family, if they're planning ahead of time, they can actually go out to eat with their family. So it's actually more feasible for a lot of our families. And at our center, the process of starting the dietary therapy usually start with the neurologist. Dr. Teal will usually, like in the visit, can recommend if dietary therapy can be the next step for the family or not. And after that, our amazing social workers, Emma and Lee, can talk with the family to briefly introduce what the dietary therapy is and also introduce what resources will be very helpful for family if they decided to try the diet. And then me, the dietitian, will introduce different types of dietary therapy and obtain some of the food diary from families to make sure that if we do decide a dietary therapy plan, we want to make sure it meets your child's need and their preferences. Because to us, quality of life is also very important, and this is not a small effort. It's a great effort for the whole family to commit to the dietary therapy. And after that, we obtain a baseline labs just to rule out potential nutrition deficiency or any contraindication, like if people cannot metabolize fat appropriately, they will not be appropriate on a diet. And then, of course, after initiation, depending on which diet they goes on, for ketogenic diet, we usually do it inpatient. So we admit the kids for over 3 to 4 days to start them on the ketogenic diet. But for the low glycemic index treatment, you can usually start at home. So that's why another reason why we prefer the low glycemic index treatment. And the follow-up visit will be every 3 to 6 months, and we closely monitor the kids' height and weight, their growth, and also labs to make sure they are receiving all the nutrient appropriately, and also they are growing at a good, appropriately too. And here are some of the resources for the dietary therapy. There are a lot of great resources like the Matthew's Friends, Charlie's Foundation, and the Epilepsy Foundation. They all provide incredible, amazing resources that you can look at for the dietary therapy. And also thanks to one of our later speakers, Shelby, we created this amazing MGH dietary therapy guide. If you scan the QR code, it brings you to a PDF that we created to talk about the dietary therapy in more details. Yeah, and that's it. I will leave it on this screen so you can scan it if you need it. But thank you.
Thanks a lot, Wings.